How to use Cystadrops. Cystadrops is a cystine-depleting agent indicated for the treatment of corneal cystine crystal deposits in adults and children with cystinosis. Important safety information. To minimize the risk of contamination, do not touch the dropper tip to any surface. Keep the bottle tightly closed when not in use. Cystadrops dosing. Use 1 drop of Cystadrops in each eye 4 times a day during waking hours. If you miss a dose, administer the missed dose as soon as possible and then use the drops at your next regular scheduled time. Assembling the Cystadrops dropper and applying the drops. Step 1. Before using a Cystadrops bottle for the first time, check the expiration date on the Cystadrops bottle before use. Do not use Cystadrops if the expiration date has passed. After opening a Cystadrops bottle, allow it to reach room temperature before using it for the first time. Immediately after opening a bottle for the first time, write the date in the space on the carton. Wash your hands carefully to avoid contamination of the eye drops. Remove the green protective cap. Remove the metal seal. The silver ring is in 2 pieces. The ring peels off, and then the silver cap pops off. Remove the gray stopper from the bottle. Take extra care. Remove the stopper slowly and firmly. Do not touch the opening of the bottle after removing the gray stopper. Place the open bottle on a flat surface. Take the dropper out of its packaging. Do not touch the end of the dropper that will be attached to the bottle. Attach the dropper to the bottle. The dropper attaches around the outside of the bottle rim. Firmly hold the bottle with your fingers to avoid spilling the eye drops. After attaching the dropper to the bottle, do not remove the dropper from the bottle. Make sure that you do not lose the small white cap that comes on the top of the dropper. Step 2. Before using Cystadrops, check the opening date that you wrote down on the carton. Do not use Cystadrops if more than 7 days have passed since the opening date. Get the Cystadrops dropper bottle, mirror, and tissue. Wash your hands. Step 3. Using the Cystadrops dropper bottle. Hold the dropper bottle. Twist the small white cap to remove it from the dropper. Do not throw the small white cap away. Hold the Cystadrops dropper bottle with the dropper pointing down, between your thumb and fingers. If no medicine fills the dropper, move the Cystadrops dropper bottle up and down until the medicine fills the dropper. Tilt your head back. Pull down your lower eyelid with a clean finger and look up. The medicine will go into the space between your lower eyelid and your eye. Use the mirror to help you bring the dropper bottle tip close to the eye. Do not let the Cystadrops dropper touch your eyelids or any other surfaces. Gently squeeze the dropper to release 1 drop of Cystadrops. If a drop misses your eye, try again. After using Cystadrops, close your eye and press a finger into the corner of your eye by the nose. Then gently massage your upper eyelid to spread the Cystadrops over the eye. Remove any medicine around the eye with a tissue. Repeat step 3 for your other eye by instilling a drop of Cystadrops in exactly the same way. Replace the small white cap on the dropper as soon as you are done. Step 4. Storing Cystadrops. Before opening, store new, unopened Cystadrops in the refrigerator between 36 degrees Fahrenheit to 46 degrees Fahrenheit. After opening, store open Cystadrops at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit. Do not refrigerate after opening. After each use, keep the Cystadrops bottle dropper tightly closed when not in use, and put the dropper bottle back into the carton. Keep Cystadrops in the original carton to protect from light. Throw away any unused Cystadrops 7 days after opening. Use Cystadrops exactly as your healthcare provider tells you to use it. Cystadrops is for use in the eyes. Wash your hands before each use. If you use Cystadrops with other eye medicines, you should wait at least 10 minutes between using Cystadrops and your other eye medicines. If you wear contact lenses, remove them before using Cystadrops. You should wait at least 15 minutes after using Cystadrops before placing your contact lenses back in your eyes. Do not let the Cystadrops dropper touch your eyelids or any other surfaces. Keep Cystadrops and all medicines out of the reach of children. For more information about corneal cystine crystals and Cystadrops, visit www.cystadrops.com. Cystadrops, cysteamine ophthalmic solution 0.37% for topical ophthalmic use. Indications and usage. Cystadrops, cysteamine ophthalmic solution 0.37% is a cystine depleting agent indicated for the treatment of corneal cystine crystal deposits in adults and children with cystinosis. Important safety information. To minimize the risk of contamination, do not touch the dropper tip to any surface. Keep bottle tightly closed when not in use. A condition where the pressure inside the skull increases for unknown reasons has been reported with cysteamine taken by mouth or cysteamine eye drops used at the same time as cysteamine taken by mouth. This condition went away with the addition of medicine that increases the production of urine. Contains the preservative benzalkonium chloride. Contact with soft contact lenses should be avoided. Remove contact lenses prior to application. Lenses may be reinserted 15 minutes following administration. The most common side effects are eye pain, stinging, blurred vision, eye irritation, burning, eye redness, discomfort at installation site, sticky eyes or sticky eyelids, eye itching, watery eyes, medicine deposit on the eyelashes or around the eyes. To report suspected side effects, contact Recordati Rare Diseases Incorporated at 1-888-575-8344 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please view full prescribing information and instructions for use at www.cystadrops.com.